everyone. Welcome to my show, NainaMD, Beverly Hills, Fusion of Science and Beauty. My passion is always to bring credibility into anti-aging and regenerative medicine. And part of the specialty requires that a doctor or whoever actually educates people on be familiar with nutrigenomics, nutrigenetics, functional medicine. And I continue to tell these terms because I want you guys to get more familiar with these terms. People just don't understand it. And today I've got a phenomenal guest who is actually the founder and CEO of Nutrigenetics Unlimited Inc., here to tell you a little bit more about what exactly nutrigenetics is. Welcome, Ron Martin.
Thank you very much, Dr. Naina. It's a pleasure to be here.
I know you've come on my show before, but I wanted to bring you back because I really feel the audience needs to keep hearing these terms, because we're really on a cutting edge health revolution, in my opinion. Just the same with the computer technology was there. I think we are in a crisis in our health, and we cannot just look for medicines and quick fixes, and that's what we've been trying to do. But there are really amazing, healing and amazing science in nutrition and nutrigenetics and nutrigenomics, correct?
There's a great opportunity once we understand the mechanism, and now that we have been learning so much more about genes and gene variants, it really opens a lot of doors that we didn't have open to us before.
And how nutrients can affect that. And I just want to guys show you that there is validity. I was doing this like 20 years ago. I started attending nutrigenomics conferences right when we just had like one conference. And we usually used to have biochemists that used to go. There were a lot of them, I remember, were bearded at the time. And now it's exploded. The field is, I can't even keep up with the nutrigenomic conferences. There's even certifications in Europe. Remember, there's the NCMO, there's a whole societies of nutrigenomics. I can't keep up. I do a lot of my reading, but what I'm saying is I can't keep up with all the conferences that are, and organizations that are forming. Same thing in functional medicine. But this book right here is Nutrigenetics, Applying the Science of Personal Nutrition. And the author is Martin Kohlmeier, and I know he's a friend of yours. You know him.
Yes, I do.
It really establishes a lot of validity. This is not just a junk book, you guys.
That's right.
This is a real deal here. So please talk about it.
Dr. Kohlmeier is actually a medical doctor and a professor of nutrition at the University of North Carolina, where they have a big emphasis on genetics. So this is really very valid, and he's a good person to help carry that torch.
Yeah. And we were defining nutrigenetics again. Let's define it for the audience. Why don't you define what nutrigenetics is, and then let's go on and see if we can give a little bit of an example. Okay.
Sure. When we first started looking at genes and nutrition, we spoke in generalities. But now that we know about gene variants, we can speak in specifics about the individual. And really, that's the major distinction between nutrigenetics and nutrigenomics, even though some people use them as synonyms.
Yeah, because nutrigenomics really implies that you look up a nutrient and you look at what enzyme pathway, and then you say, you know what, it works, and so it's going to be beneficial. But you really don't know that because you don't know if that person has a variant for that gene or not. So what we do in nutrigenetics, we go a step further, and that is we actually can test the genes, and we can see that you have these gene variants, and then we can properly define our nutrition protocols even much better that way. And you've created a library where, let's just say, for example, a doctor, where I could apply, the way I apply that knowledge is, and I've been doing this for 10, 15 years. And you know, really, it was so controversial that I was like, people were, and I would literally get attacked by saying, what is she doing? How can she make these things work? How can she make all these people well? And you know, it was like some kind of like, I was doing some kind of like voodoo or something, and it wasn't. It was just biochemistry. So going back to that, it's basically, for example, let's say I want to like study a gene variant. Let's say the person has a gene variant for something. Then I can go and backtrack and look at the nutrients that are going to help. That's going to help me make that gene or that enzyme work better, so the reaction will go better, so to speak, the enzymatic reaction. And we know that that has validity because Bruce Ames has done so much work in rate limiting steps and the reactions.
That's right.
And so, having said that, let's give the audience a little bit of an example. Why don't you give a personal experience? I love that story you told me about a personal experience in your family.
My father had a stroke when he was in his 70s, and I've since discovered that I have several gene variants, each of which raises my risk for stroke also. In fact, the family history was reinforced when my older sister developed a stroke also. So I actually decided that I would probably want to start taking baby aspirin at least once or twice a week.
And the idea was to thin your blood.
That's right.
And the reason you wanted to do it once or twice a week is because aspirin has an effect every 72 hours. So if you do it every 3 days or so, you're going to maintain some level of an anticoagulant effect without maybe endangering yourself with ulcers or something by taking it every day, right?
But when I mentioned this to a cardiologist who is quite knowledgeable, he said, research shows that for anyone who's already had a heart attack, yes, they should take aspirin. But if you haven't had a heart attack, maybe you shouldn't because it might cause bleeding, some kind of hemorrhage. So there's a risk involved with aspirin, certainly. Yeah. But then I thought, well, am I just a normal person or am I actually a special case because of my genetics? So I conferred with 2 medical doctors, researchers at Harvard, who I happen to know through the international society that I belong to, and we discussed it. And actually, they agreed with me that if I was taking fish oil in addition to the aspirin, that the risk is manageable and in my case probably justifiable. So there's an example of doing something a little bit different than what is normally recommended based on knowledge about specific gene variants.
Exactly, and we know that omega-3 fish oils they can help also, they thin the blood down.
That's right.
And so again, and it's just knowing how to manage that, because things get taken out of context. So let's just say you just said this statement, okay? And let's say somebody followed your advice or our advice, okay? And let's say they go and they get bleeding ulcers. Then they're saying, oh my gosh, that it was that kooky doctor or that person. Right. So let's back up. How about if we say it in these terms? When you take aspirin, okay, and I think that's with any drug, and I consider aspirin a drug, okay, the platelets can go down, right? And that's how sometimes bleeding can occur.
Less sticky.
Okay, so why wouldn't you get your blood work tested at least every 6 months, right? I would recommend that patient get their blood work tested, get a CBC. I would look at the platelet count. I would see if the platelets is dropping. I would be so detailed that I would even get the amount of iron stores that you have on reserve. I would do all of that in the context of, let's say you're taking aspirin and the fish oils. And I know if I did that I could prevent that horrible danger of the bleeding, from occurring, because I'm closely monitoring that patient.
That's right.
And I think that's really where things go wrong, is when we just take, and that's with everything in society. We can twist anything in any way. That's why we have such a legal force in America. The attorneys are the ones who's making, they're ruling the world, because you can take things out of context.
What we're trying to do with our database, which is free on weekends for everyone to use, is we're trying to make people aware of this research so that they can discuss it with their physicians.
Exactly.
Because we need teamwork and partnering to actually make the best decisions.
But I think you also have to have physicians need to bring them to awareness level.
That's right.
If they're not aware, they're going to say, well, why test or what for? Well, why wouldn't you want to test, for example, if you had let's say for weight? What if you were having a gene variant where you had a leptin metabolism issue?
Yes.
So then no matter what else you did, until you fix how you can help your leptin metabolism, which is linked to obesity, you couldn't do it. I mean, there's so many variants even in weight loss, for example.
Well, a lot of times the physicians may be too busy to study this stuff. They're so wrapped up in all the other things that they do. But if the public starts looking at this and says to their physician, Doc, have you ever thought about checking my genetics? They might say, then start a discussion. Well, I haven't checked into it. Did you find something of interest? Yes, I found it on this database and it's available for you too. Let's look at it more carefully and discuss it. Because a lot of times the patients, the subjects who are on their own, can spend many hours, weeks, or even longer studying these things. I spend
every night, and I always come up with one enzyme or something that I study, and it leads me. You must be doing the same thing. Sure. It leads you to something else, and then you're starting to draw a link with this and link with this, and then pretty soon like 3 hours have gone by. And
members of the public can discover things that they can bring to the attention of their physician who might overlook it otherwise.
When people talk about, for example, when their blood pressure, right? When their blood pressure, let's say they have blood pressure. So blood pressure increases the incidence of stroke, right?
Okay.
Because and a lot of times when they're under super stress, I've had very wise doctors, including myself, tell them, well, maybe when you're super under stress, you might want to maybe once or twice a week just take an aspirin, you know, when you notice that your blood pressure goes way high.
And because of my family history, I told my son about it, and he said, well, I'm scared about taking aspirin. I really don't know if I should be doing that. But at first, when he was looking at my database, he noticed so much medical literature that was actually coming from the National Library of Medicine's database.
Yeah.
And he said, this is difficult for me. But after a while, when he became familiar with it so that he could be able to
it's
actually...
like learning a phone, right?
Exactly. It's like learning anything, like,
like
learning a new language, or even a new language, even if that language is math. You have to little by little learn the terms, but then you can put them together and you can roll with it.
Yeah.
And basically this is how we're progressing, whether it be for physicians or for the members of the public. Yeah. And I would say that the members of the public really need to be aware, because if they're uninformed and unconcerned, then the physicians have little motivation to learn it themselves.
Also, I think serious drug reactions are occurring because people
absolutely.
don't know their own variants, right?
Absolutely, and they never were tested for it.
Yeah.
So that's another thing. But actually, because of the fact that it's so relevant to the public, I recommend even high school students take a look at what we're doing on our homepage, which is the nutrigenetics.net address. We have a link where people can look at articles that I've selected that would be of interest to the general public. And those things could be things about sports and genetics.
Variants,
Yes. Or it could be about marijuana use, or it could be about child abuse, or stress, or people who work on the night shift. Perhaps that can alter their circadian rhythm, and there may be some people who are affected by that more than others. So I really recommend that even the high school students, because once they see how important this is, it really can open up a door for them to go through. It's like a STEM.
It's going to empower their health.
And could really be a great tool for STEM educators to show something to their students.
And STEM educators are
science, technology, engineering, and math.
Right.
And if they actually see that vision, they might take off like a rocket.
Yeah. What do you feel, in your opinion, pharma companies either getting on the bandwagon, or are they resisting this?
Pharma companies, I believe, have been gingerly embracing it, but not to the point where they want to alarm people because of the fact that they don't want lawsuits coming their way. But actually, we need to embrace this. We cannot be ignoring it for a long time, because then that is irresponsible.
Oh, absolutely. So what's the website that that the public can go to learn more about what kind of genetic variants, which are also known as, by the way, single nucleotide polymorphism, SNPs. They're known as SNPs.
The website is nutrigenetics.net. That's with N-U-T-R-I, nutrigenetics.net. However, an easier way to remember it is spelling it out, nutritionandgenetics.net.
I like that one better.
Yes, it's so much easier.
Thank you so much for being on my show.
Thank you for having me.
I think you've just opened up a whole new topic that I hope consumers will get themselves interested. At least I hope we've created that interest for you guys to go and look this thing up. When's the next conference?
There's actually one coming up in May in Tel Aviv, Israel. And if anybody attends that, they're going to have a workshop that talks about translational nutrigenomics. Wow. So that's really just down the alley for dietitians or physicians who want to actually use it in a practical way. And then if you go to Israel, you can take the opportunity. They're also offering cultural tours before and after the conference.
Fabulous. You'll have to keep me informed. Let me know about that one. And you guys, this has been a great show. Thanks, Ron, for coming on my show.
My pleasure.
And we'll definitely have you on again. I think I'm going to let you go to that conference.
Okay.
And then we'll have you on again to see what the update is.
Sounds
okay. Great. So this is NainaMD, Beverly Hills, Fusion of Science and Beauty, and I'll be right back with my next guest.